My name's Alyssa Espinoza, and I'm a UNC second-year physician assistant student. Prior to joining UNC's PA program, I was an active duty Army officer in the Medical Service Corps, and I also had previous experience as a CNA in undergrad. I chose to pursue PA as the next step in my career because I worked with a lot of great PAs when I was active duty in the military, and they really taught me a lot about teamwork, and I loved how they got to coordinate with different providers, and I also loved their flexibility, and that's something that I wanted for my career. I chose UNC's PA program because I really loved their mission and I loved their commitment to the veteran community. That's something that's very important to me, being from a military family and being from a military background. And I also loved their commitment to rural healthcare because I also think that's something that I'm very interested in. So far, my experience in UNC's PA program has been great. I think it's more than what I could have hoped for. The faculty are all very devoted to the students, and they just want to see us excel in every way possible, and I don't think that I could have gotten such personable faculty and one-on-one time at any other program. It was a little bit scary at first to be the first student rotating through the VA surgical team, but I think that my program prepared me very well for the rotation in and of itself. I felt like I had a good foundation of medical knowledge when I got there, and the VA team was very, very encouraging, and they were all super happy to take on a student, and it actually was one of my favorite rotations so far. I learned a lot about cohesiveness of the team, and that PAs actually do have a pretty big role in surgery. The PAs that I worked with were really great with following up and doing consults post-op and checking up on patients, and I think that that was something I wasn't really considering because I was always like, what is a PA going to do in surgery? Like, we're not the surgeons. But I think being at the VA was really cool because I got to see the PAs pre-op and then in the OR and then post-op, and they actually had a really huge responsibility in terms of how they helped out the surgeons. Following graduation from the program, I do have an interest in staying in North Carolina. I love the community here, and I love the people that I've met throughout my rotations and throughout my program. And another thing that I have been considering is possibly going back into the military as active duty, because I had a lot of great memories in the Army as well, so that's something I'm also considering. I would definitely say to anyone coming from a non-traditional military background who's interested in the PA field to go for it, even if your background in the military isn't in a medical specialty, because I feel like some of the experiences that we have are really unique and can bring a lot to the field in the terms of what we've seen, what we've done, the different types of people that we've met along the way. I think that we have a really great perspective to bring to a healthcare team, and don't be afraid of the prereqs, don't be afraid of the qualifications. There's always time to get those things done, and if it's something that you want, go for it.